welcome to the Fit and Healthy Today show. And on the heels of our discussion on antibiotics last time, and since one of the repercussions of antibiotic usage is yeast and candida infections, I thought I would address that today because they kind of work hand in hand together. However, as we're going to review through, there's a lot of things that can cause candida and yeast. Number one, obviously, is going to be antibiotics. That's where we see it most readily. Because remember, antibiotic means anti-life. So antibiotics will go in and kill trillions and trillions of these good bacteria, and then you end up with something called yeast overgrowth. Now, yeast, what is it? Most people are like, what is it? I look on my toenails and I see this miscolored, and my doctor tells me it's because of candida and because of yeast. And what it is it's an overgrowth of a single-celled fungi. And what it is it is a fungus. It's always found in low amounts in the intestinal and tracts, and you need a little bit of yeast for balance. I mean, God didn't create it for no reason. It does provide things, but when it gets out of control, once again, it has its purpose. When it gets out of control, then you end up with yeast overgrowth. And it's kind of interesting, a lot of people will complain that it definitely has a smell. It almost smells like yeasty bread. Hence, when you turn around and eat a lot of bread products that are full of yeast and you ingest them, it can cause an overgrowth of yeast, particularly in the digestive tract. So we're going to talk about it in diet, but boy, when you can look for things that are yeast-free as much as you can, that would be the best thing from prevention of yeast overgrowth. Now, where it gets into a problem is it will overgrowth into the mouth and the ears and the nose. People will end up with chronic sinusitis. You'll see it in the toenails. It gets in the bloodstream. When it's systemic candida, that means it's throughout the body. And it just finds little homes, and it just waits for you to feed it sugar. Because its simple carbohydrates are its food. Yummy, yummy, munch and crunch. So if you're eating a high sugar diet, you're feeding yeast. If you have yeast, you can't eat a high sugar diet if you want to get rid of it. So, the symptoms that are associated with yeast that we typically see for women a lot when they're on antibiotics are recurrent vaginal yeast infections. And they definitely have that yeasty kind of smell. They're itchy, they're burning, they're very, very uncomfortable. Most of the drugs that they use for these are, once again, they kill off the good bacteria and everything comes about again. So there's treatments that you can do for vaginal yeast, and we'll talk about some of the supplements later on in the show. Now see, most people, they sometimes end up with these mystery diseases of inflammation, inability to concentrate, their memory starts to go, because when systemic yeast takes over the body and you're having these sugars going in all the time, you're going to get those issues along with gas and bloating. You'll end up with constipation or diarrhea or a combination of both. Headaches, allergies, PMS. Your immune system goes downward because remember 80% of your immune is in your bowel, and if it's overloaded with yeast, then that means the good bacteria aren't in there to help produce or replicate. They're overwhelmed actually by the yeast, and so then your immune system goes down, your ability to manufacture serotonin goes down, your ability to break down your nutrients. So we see things with hypoglycemia, blood sugar disruptions, and I believe it can be a major contributing factor to hypoglycemia and to diabetes. There's some studies on that, and we had addressed it before that a lot of alcoholics, a good percentage of them, over 90%, were or are hypoglycemic. They have blood sugar issues. Athletes' feet will typically see it, itchy, scratchy, and it's difficult to catch athletes' feet if your body is in good immune system running order. So if you're in the shower and everybody's showering off in the locker room, you're not going to catch the yeast if you don't have a susceptibility or your immune system is there. It's not going to happen. Thrush, that's in the mouth. Real common in babies particularly, and what that means is they don't have enough good bacteria in their body, and they get this white filmy looking stuff on their mouth. It's kind of itchy, it burns. Once again, only in the mouth versus vaginal cavity. It can, over the long haul, cause inflammatory of the bowel, eczema, a lot of skin conditions. It can make you hypersensitive to everything. So, first line of defense. If you've got a lot of these things going on in conjunction, you might want to contemplate getting rid of the yeast and doing some diet modifications, as we're going to discuss further on. Causes, as we discussed, antibiotics, corticosteroids. If a person is doing corticosteroids, particularly those nice little Flonase and other things in their nasal passages, I've seen systemic yeast develop as a result of those. They cause the immune system or the body's ability to replicate good bacteria to dive. Birth control usage. Yeah, people don't think about that. That raises it up. There's a lot of medications such as nystatins and other meds, fluoride, other things, chlorine. They all destroy the good bacteria that can allow for yeast overgrowth. Consumption of refined carbohydrates or excessive amount of fruit juice drinking. A lot of people think they're doing their body really good by drinking those big old glasses of juice throughout the day. But I have to tell you, a little bit of juice is fine if you're not diabetic, but it definitely feeds yeast because it's pure sugar. Eating the wholesome good fruit with the fibers and the skins and things like that are on fruit, much better alternative. Improper hygiene can cause systemic yeast to occur. Unlike most people who have the belief that it can be transferred sexually between partners, most of the research that I came across says, no, it cannot. So if your immune system's good, it isn't going to be sexually transmitted between partners. If your immune system is poor, possibly could be. There's other IgA or immune system deficiencies that can occur in the body that can allow yeast to take over. So the yeast can kind of cause it, or it can be caused by immune system issues because your body can't identify friend from foes. Allergy, chemical exposures. Once again, I was talking about the fluorides, especially the type of fluoride that's found in our water that's a toxic chemical. Chlorine, which we have and we can smell throughout our water unless you have a water filter. And then allergies in combination with that corticosteroids can make very, very yeast receptive. Because remember, allergies are chronically causing your immune system to always be in heightened order and taxing the immune system. But once again, yeast can cause allergies. Allergies can cause yeast. You know, don't know whether you got the dog before the cart or the cart after the dog. When we talk about diet, and this is if you have yeast and we're trying to fight off the yeast, or you know you have a tendency towards having yeast or candida overgrowth, these are some real diet suggestions. I know this is really tough. Number one, avoid all sugars and refined carbohydrates. These yeast, they send out a little chemical message to your brain and they say, feed us, okay? And so what happens is your brain all of a sudden wants increased carbohydrates in order to feed yeast. And it keeps it an ongoing process about the yeast making you want carbohydrates, the carbohydrates feed the yeast. It's a vicious cycle. Most people can get off of most simple carbs and sugars after about usually between 2 and 3 weeks, but boy, it's tough going on. And there's some supplements we can help with sugars in that regard, but getting off of sugars, juices that feed it, number one. Number two, eat mostly vegetables, whole grains, preferably not yeast-based. Now, it is a myth that brewer's yeast causes yeast overgrowth. That, I found nothing to back that up. But there are certain yeasts that replicate, like in breads and things like that, that can be a contributing factor to bowel yeast, that can just cause the problem to get worse. So we want high quality proteins, including lean chicken and fish, as well as beans. But interestingly, I found in most research is beef can be a contributing factor, interestingly enough, to autoimmune and immune disorders, beef and pork both. If you have immune compromise as well too, but immune compromise beef, don't eat pork. You're going to want to stick with a higher quality source of protein with lots of veggies. Eating fermented dairy products like kefirs, yogurts, buttermilk, but not milk. Milk is not a cultured product. It has a lot of sugar, a sugar called lactase. And so you drink a glass of milk, and diabetics of all people should never drink milk because it's full of sugar and it can feed yeast. The cultured products tend to balance out because they do have some good bacteria. Not enough to overwhelm and get rid of yeast, but enough to keep the food that you're eating from contributing to the yeast. Supplement-wise, oh man, number one beyond anything else is going to be probiotics. Those are the good bacteria that can help overwhelm the yeast. The only problem is if your body, particularly your intestines, is full of yeast, in order for the bacteria to deep seed, you have to get it gone. So the dietary changes, and there is tons and tons of research on oregano and grapefruit seed extract, and naturopathic doctors and homeopathic doctors have used these types of products, maybe not in their extracted form, for centuries. So unlike some of the yeast-fighting drugs out there that causes problem to get worse eventually, this is anecdotal evidence that supports that things like oregano extract and grapefruit seed extract kill yeast. Garlic, phenomenal as a yeast killer. Goes in there, well, phenomenal for a lot of things, blood pressure, cholesterol, my gosh, keeps things from building up on the vascular system. It's an antimicrobial, and I'm coming at it from the aspect of it's an antimicrobial. It kills viral, fungal, and bacterial infections. If you like your garlic, there are deodorized supplements out there that you can take that won't make you smell, that will do the job and helping keeping the yeast under control. Otherwise, if you like garlic and no one around you is offended, do it. Podiarco, we have a local physician that whenever he sees toenail fungus, besides getting the good bacteria and trying to get people to get their sugars down, because since he's a proponent of a lower carb diet, he will have his patients soak their feet in something called Podiarco. Now, I've seen success with Podiarco and tea tree oil, which I didn't write on here, that you can topically apply that can help with things like toenail fungus. The only problem is most yeast, by the time it's in your toenails, it means it's systemic. It's in your bloodstream, it's there. So it takes a lot more than just putting a little bit of tea tree oil and Podiarco. Yeah, we can get rid of it for a little time being, but we need to treat the whole body with the diet modifications as well as trying to get rid of the yeast. Interesting enough, too, as a side note, the people that tend to have higher yeast will get salmonella poisoning quicker, food words, and flu much easier. It really draws down. So, good multiple vitamin, high in B vitamins, good extra amount of ester C, which is a vitamin C that stays in the body a good 12 to 24 hours. We're trying to boost the immune system and the body being able to identify a friend from a foe. And since most people's diet doesn't contain these types of vitamins in good wholesome amounts, the good multiple vitamin, and I'm not talking from the grocery store, I'm talking a good multiple vitamin, along with some ester C really can help. In addition, interestingly enough, the ester Cs are natural antihistamine, and since most people that have yeast have more allergies, this can also help with the allergies. Essential fatty acids. Now, what's really interesting, and I ran across a lot of good research, and we know that they help with blood sugars, inflammatory response, and cholesterol, and a lot of other things. Flax oil, fish oils, and certain types of, especially like almonds, they actually prevent the fungus from causing cellular DNA, RNA damage. So those people out there who are eating a lot of good fats in their diet, be it the nuts like almonds or avocados, fish, and in my case, flax oil, sesame oils, there's all those types of good fatty acids really help your RNA, DNA. It protects it and protects those healthy cells from yeast and bacterial damage as well, too. Oxygen drops. Boy, I know these have a lot of different usages, and there's different ones. Cell food, there's oxygen. I mean, you can look and you can get food-grade types of oxygen. And what this basically does is it destroys the fungus, because fungus does not like helps as you're oxygenating. It helps the body detoxify. On the same premise, you can add things in that are high in oxygen. Now, wholesome good greens and things like that, chlorella, spirulina, those things that induce oxygenation can also help the body fight off the yeast and preserve the good bacteria. Unlike the nystatins, which destroy all the good stuff in there as well, and then everything goes back to normal as far as having issues with yeast. Quercetin and bromelain. We get a lot of people with yeast that got a little itchy and they get hypersensitive and things like that. When we combine the ester C with quercetin and bromelain, it really does help the inflammatory response and the allergic response to this yeast that we seem to be replicating at phenomenal levels in this country. There are lots and lots of other supplements that work: caprylic acid, coconut oil that you can do on a daily basis, especially coconut oil on a nice piece of whole grain toast. There's other things that you can do to help maintain and get rid of yeast dietary wise, but I've kind of given you just a synopsis of basically what I know is most common. I hope that helps you. Next, we're going to be moving on to the fitness portion of our show. Thank you very much. Hi, welcome to the fitness portion of our show. And once again, you got me on my knees and on the floor, and I have my 11-year-old son and a friend of my older son to thank for using the ball today in some exercises that may help give you a little bit of relief for back pain. First of all, getting a nice ball that's correct for your body size, and this one's kind of a medium one. It could be pumped up a little bit more. But what I would do with this particular motion is I would kind of just curl my spine around it. Now look, I'm completely supported. I'm kind of like almost doing a yoga move that would be kind of like a cat kind of a movement. But I'm stretching out the erectors, getting my spine, and then gently getting back up again, and then I'm going to flip it, because always remaining in balance, I think, is probably the most important thing. So where we do a positive move, we do a negative move. It's always in balance. And what my son's 22-year-old friend was doing is he was rolling on the ground, and he was just massaging his back. He was kind of laying back here like this. And he got up from my little ball, and he says, "I need one of these for Christmas." Because bottom line is his back felt a lot better. But what it was doing is it was massaging, it was getting circulation into the spinal area, and kind of stretching the back out in a very supported way. Anyway, I hope this helps. Experiment. They're very inexpensive, and there's a lot of different exercises you can do with these balls. Next, we're going to be moving on to the research portion of our show. Thank you. Welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
Thank you for the intro. Well, now it comes down to vitamin D again, but this time for pregnant women, especially for the newborn infant itself. Now the question always been at hand, is vitamin D safe for pregnant women in large dosages, and how much should they require? Well, researchers made a good determination of how much vitamin D they do require. And this information was presented at the Pediatric Academic Society meeting in Vancouver, British Columbia. How much they determined was this? Well, let's put it this way. They based it on preterm labor, birth, and infections. And they gave a couple different dosages: 400 international units, 2,000 international units, and 4,000 international units. They also tested it for toxicity and potentially any side effects. They found out the best results with zero toxicity was 4,000 IUs of vitamin D per day for the pregnant lady herself. They said, quote, "The diet is not providing enough vitamin D." And they also said there were no adverse events related to vitamin D dosing were found in any of the three arms of the study, the 4,000, 2,000, and of course the 400. Now, they said the spectacular part of the study was it showed women replete in vitamin D had lower rates of preterm labor and preterm births and lower rates of infection, said Dr. Wagner, the lead researcher. So, pregnant, plan on being pregnant, do your vitamin D. 4,000 IUs. You're not going to find it in your standard prenatal. If you were lucky enough to see this show, do it now. Because chances are, before your mainstream media picks it up and actually does some sort of news reporting, that'd be long past time. And now, for another one, which you like, and this is especially going to be important to people with chronic obstructive pulmonary disorder. and it's a plant called periwinkle. Why is this weird sounding plant so important? Well, they found that it's a powerful anti-inflammatory. And the reason it's important for people with COPD is this: often they only prescribe steroids. The problem with that is steroids were not designed for long-term use. Therefore, having a ton of different effects, from creating diabetes, liver problems, so on and so forth. And this is what they said. This is published in the Proceedings of the National Academy of Sciences. They said there is an urgent new therapy, there are need for urgent new therapies for the treatment of the COPD, as well as ear infections and arterial sclerosis, and any chronic inflammation, including of the arteries. They found what is extremely exciting and promising about this periwinkle is its incredible safety profile. Now, periwinkle, to back up, you may also know it as vinpocetine. If you walk into a health food store, it's been on the shelf for years. So previously, most drugs tested in this area failed because of the lack of efficacy. But they found out that vinpocetine, henceforth, or periwinkle, decreases the inflammation, targeting the activity of specific enzymes known as IKK. IKK is responsible for regulating inflammation. They also said the therapy has no evidence of toxicity or noticeable side effects in human patients. Scientists at the University of Rochester hope to reposition this compound as an anti-inflammatory agent for the treatment of COPD and potentially other inflammatory conditions such as asthma, otitis media, ear infections, rheumatoid arthritis, arterial sclerosis, and psoriasis in the future. Very promising. Again, either known as periwinkle or vinpocetine, can be found in most health food stores, or at least decent ones. Outside of that, now we go down to broccoli. Broccoli has one unique effect that chemo drugs, according to the research coming out of the May 1st issue of Clinical Cancer Research, that chemo drugs do not have. Chemo drugs may kill the cancer or have an effect on the cancer, but broccoli does one step better. It stops the stem cells which produce the cancer, or I should say cancer stem cells itself, because there's a component in broccoli called if I can pronounce right, sulforaphane, which actually they say targeted and killed cancer stem cells and prevented new tumors from growing. Real promising. They said the concentration of this component found in broccoli or broccoli sprouts, otherwise known as sulforaphane, used in the study were higher than can be achieved normally from eating broccoli or broccoli sprouts itself. Another thing that you could find on the shelf in most health food stores. Talk to your oncologist about it, see if it can be a good adjunct, but it gives an extremely powerful extra arm to people going through chemotherapy, and it actually gets to the root of the cancer itself instead of killing cells which are already turned to cancer in its own place. Otherwise, something to definitely look at, and it's very, very, very promising. Now, let's go to Crohn's disease. How many people want Crohn's disease? Or do you like Crohn's disease? What's your best chance of increasing your risk of Crohn's disease? About, let's say, 5 times over the normal individual. Take aspirin on a daily use. What came out of the Digestive Disease Week conference in New Orleans, they found out that people who regularly take aspirin for a year or more, just a year, increase the risk of developing Crohn's disease, according to the new study out of the University of East Anglia. The UEA team followed 200,000 volunteers, aged 30 to 74, in Britain, Sweden, Denmark, Germany, and Italy. The volunteers have been recruited for the EPIC study, called the European Prospective Investigative into Cancer Nutrition, between 1993 and 1997. The volunteers were all initially well, but a number developed Crohn's disease. And the only difference they could find in all the studies was that they were taking aspirin. And they said, quote unquote, they discovered that those taking aspirin regularly for a year or more were around 5 times more likely to develop Crohn's disease. Something to consider if you're prone to digestive disorders. And another thing to consider if you're prone to digestive disorders, especially those with ulcerative colitis. Here's an easy way on the other end to prevent ulcerative colitis if you find yourself prone to it. And this also came out of Digestive Disease Week conference in New Orleans. The researchers, led by Dr. Andrew Hart of the University of East Anglia School of Medicine, studied more than 25,000 people between the ages of 40 and 65 living in Norfolk, at UK. The volunteers were recruited for the study, and between 1993 and 1997 again. The participants of none who've had ulcerative colitis prior to entering the study at the outset. They completed detailed food diaries and were later analyzed. Well, guess how much reduction in your chance of getting ulcerative colitis were if you would do a good amount of oleic acid or olive oil. Your chance of reducing the risk of getting ulcerative colitis was reduced by 90%. They're wondering if it even can fix the problem in people that currently have it. So, if you're concerned, if they said, quote, we estimate that around half of the cases of ulcerative colitis could be prevented if larger amounts of oleic acid, coming from olive oil, were consumed. 2 to 3 tablespoons of olive oil per day would have that protective effect. Something really easy to do if you have the opportunity to do it, and you should. Olive oil is pretty much everywhere. Now, fatty liver disease. This one's also, again, another vitamin. And this one, surprisingly enough, is vitamin E. They compared vitamin E to a drug called Actos, because Actos is primarily given to people with fatty liver disease. It's also estimated that about 10 to 20% of the U.S. population does have fatty livers, even though it's asymptomatic. Well, guess what beat the drug? And I mean beat it bad. Vitamin E. They said, quote, the good news showed that this study showed that cheap and readily available vitamin E can help those with the condition. We also looked at the drug, cannot pronounce it, pioglitazone, which showed some benefits, otherwise known as Actos, but not as dramatic as with vitamin E. After 96 weeks treatment, vitamin E improved all features of non-alcoholic fatty liver disease, with the exception of the amount of scar tissue in the liver. 43% of those people treated with vitamin E actually finished the study, compared to only 34% of those people taking the drug. Plus, the drug had one more detrimental effect. Those taking it for 96 weeks gained 10 pounds, while those doing the vitamin E did not. But keep in mind, they had to stay on the vitamin E. And also, last but not least, in the Journal of the National Cancer Institute, the overdiagnosis of cancer. They estimate 25% of breast cancer overdiagnosed, 60% of prostate cancers, and 50% of lung cancers are overdiagnosed. Unfortunately, I'm out of time, so we'll wrap it up there, but thank you very much.
Thank you very much, Ralph. A lot of good information. Thank you. Do your research, try, practice, do what you can to help yourself naturally with no side effects. Have a great day.